I'm Dr. David Rosensweet. I'm a holistic medical doctor, and I've specialized in treating women in menopause with bioidentical hormones for the last 25 years. And I wanted to comment on a question, both specifically and in general, on some of the responses. And the question was this. I don't understand this. I have not started anything except vaginal estradiol and progesterone cream. I'm postmenopause plus hysterectomy, and I have my ovaries. My testosterone is actually above range. I still want it way higher, correct? And then this questionnaire actually posts a testosterone test result, which is a little bit over the upper limit of the range that was expressed by the laboratory. And laboratory, and then a question comes up, a response comes up, quote, standard range, end quote, is just the variation seen in people your age. The value means absolutely nothing. I understand that comment because really what we prefer to do in the method that we use is we like to compare a woman's laboratory value to that of a 20 to 29-year-old because that's when a woman's hormone levels were the most robust and healthiest. It's not that we're trying to replenish hormones to those youthful levels. In fact, there's some pitfalls there, and we don't have that strategy, but it's a good reference range to compare to because, like, why in the world would you want to compare a 60-year-old woman's estrogen level or testosterone level, that for that matter, to that of her age range, 60 to 69. Laboratories do this according to decades. So I understand that comment, but the part that I wasn't in agreement with was part of the comment was, and yes, comma, you want it higher. Well, let's talk a little bit more about specifics with testosterone. What the original questionnaire showed us on the screen was the total testosterone level, and it's just not enough information because in the world of testosterone, you want to know what the free testosterone level is. And you want that in a reasonable reference range, that's for sure. But there's so many issues out there around not having enough free, but having what appears to be an excessive amount of total testosterone. And it's based on this sex hormone binding globulin issue. So my main concern about this response is there's not really enough information. In order to understand your question better, we need to know what the free testosterone level is, and or we need to know what the sex hormone binding globulin is to give an adequate answer. Now let me tell you what happens in general. For one thing, there are a certain number of women that actually arrive in the perimenopause or early menopause, and of course you've had a surgical menopause, but you still have your ovaries, so we don't know exactly where you are there. And they actually have adequate testosterone. Used to be a lot more common in my experience than it is these days. There's some women who enter the perimenopause and their testosterone is slightly elevated. And we try and reverse engineer this and explain it because that one option a woman's body has when her estrogen drops is to increase her testosterone a little bit and convert that testosterone to estradiol. Now, she will not be able to keep that up, and invariably, I have yet to see any woman 3 years into menopause that has sufficient testosterone. It doesn't happen. I don't see it. And I'd like to put in a suggestion around how to test hormones and get it right. And for certain, once you're treating a woman, the only thing that I accept, and people will have a discussion with me about this and not agree with me, is the 24-hour urine hormone test. It gives you an accuracy and a real-time evaluation of how much hormone is making it into a woman's body that she's actually taking. We want to get her hormone levels that she's receiving in her body while she's being treated. We want to know how high are those going, or are they inadequate? 24-hour urine hormone testing. And I'm also suggesting that anytime you choose to test a woman and you want to really assess her hormones, around perimenopause or menopause, you want to do the 24-hour urine hormone test. Now, here's an interesting thing. When we think of the stress response, there's a tremendous hormone recruitment for fight or flight. And that the vanguard of that hormone output to prepare you to fight a saber-toothed tiger or run from it is adrenaline and cortisol. And yet, those are not the only hormones that are recruited. Estrogen is recruited. It's a good animating hormone. Testosterone is recruited. And it seems to me more than ever before, more than earlier in my career, that so many women are arriving in the perimenopause and the menopause with depleted testosterone. They're still capable of producing it in their ovary and certainly in their adrenal glands, but they're already low by the time of perimenopause and menopause. So one of the commenters' suggestion that, and yes, you want your testosterone higher, that's a fairly good guess, but I want to tell you, be cautious. You really want to know whether a woman in the perimenopause or early menopause, you want to give her testosterone, because if you give her testosterone and she doesn't need it, she's going to grow hair, for example, on her chin and her mustache area and have other untoward effects that she's not going to like. So I like to get that one precise. And one of the ways you can tell is by simply asking a series of questions. Asking a woman, does she have some of the testosterone depletion symptoms? When testosterone goes too low, you get a drop in libido, you get a drop in energy, you get muscles aren't as strong. You can't get up from a chair so easily without using your hands. You get flab in your triceps area. So there's a lot of suggestions, symptoms and signs of low testosterone. Again, the part that I didn't agree with is just saying, well, for sure you need more. You don't know if she needs more or not. And if you're a prescriber and you make the error of giving a woman who already has adequate testosterone, additional testosterone, she can have some untoward effects. They're reversible, so it's not that big of a deal. But we're in the world of medicine, and it's really good to get medicine precise. And if you're going to make comments on prescribing, I'd say be tremendously knowledgeable or don't take a whack at it, because the human body is so intricate and complex. And then here's a second comment. The lab ranges for women's testosterone are notoriously low. Your body is apparently still producing a decent amount of testosterone or DHEA, accounting for your level to be slightly higher than average. You would very likely feel better if you increased it. Again, that's not a comment I would make when you're actually a prescriber partially responsible for the well-being of a patient. Want to stay away from making shoot from the hip suggestions there. And especially once you start treating a woman, if you are not using the 24-hour urine hormone test, I'm going to assert you're not going to know how much is in that woman's body. So, yeah, just a call for be sure when you enter the world of hormones, or my request would be as you enter the world of hormones and making suggestions about it, that you get a little more knowledgeable and a little more accurate than what's being presented here. I know that's a little touchy, but then having dealt with a lot of women and prescribed hormones, I can tell you the women want you to get it right. And this is not enough information. You need to know what her sex hormone binding globulin is and what her free testosterone is. And yes, better to compare it to a younger age range, but I don't know how old she actually is. There is some wisdom in saying that you got to really understand your way around reference ranges. All righty, bit of an intricate response there. Best to you all.